Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas, who has been practicing cardiology for more than 40 years. The main focus of this feature presentation is COVID vaccines. The longer the interval between the doses, the longer the protection. Or is it? And this question was answered in the most recent study from the United Kingdom. So let us begin with the feature presentation. A study from UK reported in the European Congress of Clinical Microbiology and Infectious Diseases annual convention last week about their study involving patients with infection, without infection, those who had the second dose 21 days after the first one, and those who had like 12 weeks after the first dose. So we're going to look at all these different subgroups and see who had the best response in terms of antibody protection. You will be really surprised. Basically, they answered many questions. What is the optimal timing for COVID vaccinations? What is the ideal time interval between the first dose and the second dose? How long does a person with a COVID infection wait to get the vaccination? Does it make a difference whether they get it at 1 month interval or 6 months intervals? And finally, how long does the protection last? Let's look at their study results. This was a study conducted by the United Kingdom Health Security Agency. It involved 6,000 healthcare workers. They were divided into basically two groups. The first group received their second vaccination 21 days as it was prescribed by the pharmaceutical company after the first dose. The second group consisted of people who received the second dose 10 to 12 weeks after the first dose. As we know, last year around April, UK Prime Minister Boris Johnson decided that they were going to give the second booster dose 10 to 12 weeks after the first dose so that more people can get the first dose in order to prevent serious infections. Did it work? We'll find out. In the same study group, they also looked at people who had previous history of infection versus those who never had previous history of infection. What are their results? Interestingly, they found that people who had previous COVID infections, when they received the COVID vaccination, they had antibodies 10 times higher than those who had no previous history of COVID infection. That's a very startling new observation. And secondly, people with the previous COVID infections had 2 times higher antibodies than those people who had no previous infection and had developed antibodies after COVID vaccination. How about that? So their study basically found this startling difference between those who had vaccinations 21 days after the first dose compared to those people who had more than 10 to 12 weeks after the first dose. The antibody response was 9 times higher in the group that received the second dose 10 to 12 weeks after the first dose. As you know, the UK was criticized for delaying the second doses, but retrospectively, it turns out those who received the vaccines 10 to 12 weeks apart did far better than those who received vaccines 21 days apart. And it even got better in the younger population. As you know, there are a lot of healthcare workers who are in the younger age group, unlike people like me. The dosing interval did not affect antibody. The dosing intervals did not affect antibody levels in those with previous infections. So those people who had previous infections, whether they received 2 doses 21 days apart or 10 weeks apart, it did not make the difference. And interestingly enough, those people who had COVID infections and waited for like 6 to 8 months before they got the COVID vaccination, they did far better than those people who received the COVID vaccination right after the COVID infection. Like the general recommendation here in the United States is you get a COVID infection, wait for 10 days or 5 days and get your COVID vaccination. But in reality, you should allow the body to develop these antibodies through natural immunity and then boost it with the COVID vaccination. That makes a lot more sense, and that is an observation that came out of this study, which I thought was very interesting and clinically applicable. So that if someone has a COVID infection, it may be wiser to wait more than a month, according to this study, to get a better antibody response. Interestingly, they found out those people with COVID infections who received their first dose of vaccine 8 months after the infection had levels 7 times higher than those people who received the vaccination 3 months after the infection. So there's the answer, ladies and gentlemen. Of course, this is one study. Based on this study, it makes sense to wait if you had infection before you get the vaccination, because the longer you wait, the better is the antibody response to the vaccine. So in conclusion, this study showed that those people who received the second dose 10 to 12 weeks after the first dose had a significantly better antibody response compared to those who received the vaccine 21 days after the first dose. And those patients with COVID infections in the past had significantly higher antibody levels after the COVID vaccination, and they did much better if they received the COVID vaccination 3 months after their COVID infection. So, ladies and gentlemen, thank you so much for watching this presentation. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. And please do subscribe to our YouTube channel, and I will see you in the next update on COVID pandemic.